So I think my passion for health visiting really started when I was a student nurse.
Okay.
And I did a placement with the health visiting team, and I don't think I realised how much health visitors actually do. And during the placement it was amazing. I learned so much, and I saw how much the health visitors support the local communities as well, and how they support families, and I just knew at that moment that was what I wanted to do. And then did a few things in between, but kind of found my way back into the health visiting team then. And I just think it's such an amazing job. All the things you can do for families. I think the support you can offer new parents as well when they become a parent for the first time, because it's really hard having children, and to be able to offer that support is just amazing. I feel so privileged to work so close with these families. I think it's amazing how we can do so much health promotion as well, and work close with families and within the local community as well. That's a big thing, especially around here, getting out in the local communities, working with our family support workers, and just trying to promote the health outcomes of the communities as well. So I've done a lot of work with children with chronic health conditions and parents with health conditions. So if we can get in there earlier and promote better public health, I think that's amazing. And just really important for early intervention things as well, and just to work so closely with these families is just, it's such a lovely feeling. It's so special. Yeah, I just love it. It's definitely my calling. It's what I want to do. There's quite a lot of career progression actually, which I didn't realise until kind of coming into the role. So I started off in health visiting as a Band 5 registered nurse, and I worked there as doing that for about 18 months. So I was doing a lot of the developmental reviews, supporting with things like toileting, behaviour, and kind of just working with their health visitors then to support them with whatever they needed. And then I went on to do my health visitor training then, which has been very challenging but so rewarding as well. I've learned so many different skills. My confidence has grown. I've built my resilience. So it's been really lovely. So I've done my health visitor training now with the goal of then qualifying in April, and then I'll be just a health visitor then when I've qualified. But in terms of going on from just being a health visitor, there's loads of different specialist roles you can go into. So there's specialist nurses for looked after children, there's specialist health visitors for ALN, specialist health visitors for homeless, gypsy traveller families, all those kind of things. There's lots of different roles you can go into, which is really, really interesting. And there's a lot of focus on education as well. So I know you can go into specialist roles for education, and you would be running the training programmes for the health visitors. So that's really exciting and interesting as well. So yeah, there's a lot of career progression actually, which I didn't realise. I think health visiting is one of the most important jobs in the world, to be honest. The first 1,000 days of a child's life from conception are the most important. Those days allow the kind of foundation blocks to be built for the rest of a child's life. They're so important for brain development, for building resilience, building life skills. So the fact that health visitors can support families within those first 1,000 days are amazing. We can go out and we can provide emotional support for parents. We can monitor child development, which is really important. We can get early intervention in place if there are concerns with anything with the child's development. And we can just work with parents to get them to understand why it's important, those first 1,000 days are important. So I think that's one of the main kind of important roles of the health visitor. And I think just being out in the community, promoting better public health, it's really important. I think if we can invest in the early years of children's lives and invest in the families, we can promote better public health. We can have better health outcomes, with better mental health, better support systems, better community spirits as well, because we are kind of working within the heart of the community. And I think for health visiting as well, you are in those families' homes. It's such a privilege to be allowed into families' homes. It's so important that we can build those relationships with them. We can support them. We can make sure that their health needs are met, and that they feel prioritised and they feel listened to. And just by being able to do that, we can give children the best start possible in life, and we can really make sure that they reach their full potential, which is just amazing, really.